In this video, we will see about periodontitis, that is the disease of the periodontium. As per AAP definition, periodontitis is defined as inflammation of the periodontal tissues resulting in attachment loss, alveolar bone loss, and periodontal pocketing. In the 1999 AAP classification of periodontal diseases, the separate terms were given for chronic and aggressive periodontitis. But in recent classification 2017, both the type are clubbed together under the single heading of periodontitis and staging and grading are given. But the terms chronic and aggressive are still clinically relevant and features and differences are still valid. Let us see the different features of chronic and aggressive periodontitis. When we call a periodontitis to be chronic or aggressive. Let us see the common features and differences under particular headings like age, cause, and the pattern of distribution. With regard to age, in chronic periodontitis, usually it affects the adults. Children may be affected, but it is very rare. Whereas in aggressive, mostly the teenage and young adult population are affected. Circumpubertal ages. Earlier, juvenile periodontitis was a term given, but it is included under aggressive in recent days. Terms like juvenile periodontitis, early onset periodontitis were used before 99 and were clubbed into aggressive at that time. Then, when we see about cause, chronic periodontitis is mostly due to the local factors present, that is, plaque and calculus and other local factors. And the destruction is consistent with the amount of local factors present. Presence of subgingival calculus is seen here, and microbial pattern may be variable. We will see about red complex, orange complex bacteria, and all the type of bacteria may be associated with chronic periodontitis in some or other way. Whereas in aggressive periodontitis, the amount of local factors and destruction is inconsistent. For very little amount of local factors, the amount of periodontal destruction present is much more. And also the presence of a familial aggregation, that is, if sister is present with presence with aggressive periodontitis, there are much more chances that her siblings may also have aggressive periodontitis, and her parents may also have aggressive periodontitis. And regarding microbial pattern, it is mostly associated with aggregatibacter actinomycetum comitans. This is relatively an old concept. In recent times, in aggressive periodontitis also we see other bacteria present, and therefore in the 2017 classification, the difference between the aggressive and chronic has been blurred out and be clubbed under the single term of periodontitis. And again, the presence of genetic susceptibility is seen in aggressive periodontitis. Hyperresponsive macrophages and presence of PMN dysfunction, neutrophil dysfunction is common in cases of aggressive periodontitis. We saw about the age factor and the cause which differentiates chronic and aggressive clinically. Now let us see about the other features, that is the rate of progression. In chronic periodontitis, usually there is slow rate of progression or moderate rate of progression. Whereas the name suggests aggressive periodontitis, there is a rapid destruction of periodontium. And the periodontial destruction cannot be determined with the help of probing depth alone. Periodontal pocket may mislead. Therefore, we have to see about the clinical attachment loss. Let us see about that later. And also, chronic periodontitis can be modified or associated with systemic diseases like diabetes or other systemic diseases, and modified by environmental factors like smoking, such factors. Whereas usually aggressive periodontitis patients are clinically healthy, apparently healthy patients who does not have any apparent systemic illness. Again, chronic periodontitis can be classified as either localized or generalized, based upon the number of the teeth affected. In localized periodontitis, the localized chronic periodontitis, less than 30 to 30% of the teeth present are affected, whereas in generalized, greater than 30% of the teeth present are affected. That is, if 32 teeth are present, 30% of the 32 teeth is approximately 9 teeth. Therefore, if more than 9 teeth are affected, it is generalized chronic periodontitis. If less than 9 teeth are affected, it is localized chronic periodontitis. Similarly, in aggressive periodontitis, also we have this localized and generalized classification, but the factor which determined in chronic, that is 30%, will not be applicable here. In localized aggressive periodontitis, we have the incisor and molar involved, permanent central incisors and first molars involved. In IOPA, we can characteristically see vertical or arc-shaped bone loss since only those two teeth are involved. Apart from these two teeth, maybe one more teeth can have at clinical attachment loss. As I already told, probing depth or pocket does not alone determine it. We need to see clinical attachment loss. And similarly, for generalized aggressive periodontitis, more than three teeth are involved. Similarly, in localized aggressive periodontitis, the serum antibody response for the particular microbial factor is high, whereas in generalized aggressive periodontitis, it has a very poor response, and the disease is of intermittent nature, may present in episodes in generalized aggressive periodontitis. Thus, in this video, we saw about chronic and aggressive periodontitis as two different entities, how they may differ, and the main factors which decide the difference. See you soon in the next video.